My name is Dr. Moss. I am the program director, which means I have all of your information. I have your personal statement, I have your ERAS, I have your step scores. So first off, tell me a little bit about yourself. Opened up by giving us a little bit of history about you, talked about your hobbies, your family environment. I would have loved a little bit more on who you are as an individual. I'm thinking back to your personal statement and the things that meant a lot to you, talking about the community, why that was important. Maybe even talking about something that I wouldn't get from just a paper. So your values, your passions, and then tell me a story, like a beginning to end, especially since you have a couple more years than other individuals. Tell me specifically in as quick as you can what the past years since you've been in medical school. Give me a little bit. I don't want to talk about why psychiatry, because I feel like why psychiatry will be a question as long as you're focusing more on you as an individual and how systems or things that you've seen have changed who you are as a person, which have then led you to medicine, to psych in that sense. Much about you as possible. It's like the only time in this entire interview where it's all about you. You'll spend the rest of the interview talking about what different specific examples have led you to the career path. Focus more on you. I'm going to pull up my residency workbooks and that might help you. It's on my website. I created back in July. I'm going to do some more updates. Here it is. There was a specific area that might help you. So these are some ideas you can pull from. You can talk about the activities you've done or different qualities that have appeared throughout your life that have brought you into medicine and brought you to psychiatry. And of course, those are not all of them. Those are just a list. Strengths, you could also talk about strengths during it. Some of them are similar. I like to think of values for the first question, strength throughout. I love the word compassion. I think that is a key one that you can bring in because compassion, I like to say compassion toward others, maybe less of others providing you compassion, more you providing others compassion and you providing yourself compassion. Psych focused topic, bringing it onto yourself or a different challenge that brought you to notice that compassion was your value. I like to also think of this sets the tone for the conversation, especially for psychiatry. I've noticed that psychiatry is less about having questions pre-prepared and more about what you start talking about and follow up. If you start talking about your sports, I'm most likely going to ask you, what sports? Why are sports important to you? Should we encourage sports for psychiatry? See how it follows through, because that's more of the psychiatry way to do things. I think the more you think about it, journal it, and try just notice from the very first time you answered already to the third one, I'm getting a little bit more about who you are as a person. So then just keep building. And it takes time. When I was practicing for interviews, it took me a lot of iterations until I finally was able to find the way to perfectly to start the conversation. I noticed that you've spent quite a bit of years between medical school and now. Can you talk to me a little bit more about that? I'm glad that you explained about mental health. Even though I saw that it was on there, I didn't automatically think about it in that sense. I really liked that you turned it around to show how you've been spending. I liked how you connected it to psychiatry early on and how that brought in some skill sets that you can now bring into psychiatry. I would have loved specifically, this is the lessons that I've learned. Maybe like I learned how important research is, or I learned how important research is to the community, or I learned a different aspect of science that I didn't have experience. Bring it back to lessons learned. Is this something that you want to continue in residency? And tell me a little bit about what you would like to study. I love that you connected specifically to the program. I think that is so key that every single program, what they currently do, especially if there's a unique aspect that other residencies don't have or unique connection to you, always make that. Do you have any experience with applying to IRB? I would say that because not many individuals have any experience with the IRB or grant writing. That is such an important skill set that you can bring to a residency program. So I can see a lot of, especially program directors that are very interested in research or even attending. Obviously, if you apply to a community program, less important for you to talk about, but an academic program, they're more heavily on that research side of things. Yeah. You mentioned geriatric psychiatry. Why is that of interest to you? I was thinking in the back of my head, you're explaining that you're an advocate without saying you're an advocate. And you said this is personal. I would love to hear more. You get to choose how much you disclose or not disclose, but if you're going to say personal, or even if it's just a patient that you met with during your research year or a family, include that. It's almost like the why you. I got so many strengths of passion and selflessness, importance of family, the taking lessons from others, humility, so many great skills that are key as a psychiatrist. I always like to have a story, have a patient example that no matter what the question is, you can bring it in. What are other questions that you think you can incorporate that story? Tell me about a challenging time in your life, or tell me about when things didn't go as planned. I want to challenge you to think about people that are not the program director and assistant program director. They don't have your ERAS, your step scores. So what are you going to say when they ask you the question of your challenge? Are you going to disclose or are you not? You get to choose how much you disclose or not disclose, because when I applied also with a lot of red flags, had to decide, do I disclose my leave of absence? Do I disclose my failures? I did, based off of the individual person I was working with. There were some attendings that I was interviewing with that I didn't feel would be receptive and would be very, nope, you failed. I don't like it. Normally, there would be more older individuals that would be more rigid versus more younger generations, 50 less, would more understanding. In general, they're more understanding. But I also went on, how's the conversation going? Are they asking me questions to get to know me as an individual? Or are they asking questions to compare me to someone else? Because every single person you interview with, you want to leave a positive impression. Is it going to be more of a positive impression that you failed and learn from it? Or is it going to be more positive impression with something else? Think about, you can still give the same example just without saying the failures. You can say the same thing without the words that you failed step exams or you took the leave of absence. We would have no idea and it would be as powerful and meaningful. Especially the part that I had to decide between what's important to me, family, my career, and that shows me more about who you are and the amount of introspection you're able to have. And there's no need at that sense to talk about failures, unless I specifically asked you about a failure. If you trust your gut and your gut is wrong, that's okay. You tried and you listened to your gut, and that's all you can do. Why the United States versus working in Canada? It's so hard, especially when you have such a strong negative opinion, to not say said negative opinion. For me, it would feel inauthentic, but we have to think about in an interview, we want to get a positive impression in 10-15 minutes. So if you spent any time saying something negative, they're going to be more thinking about the negative thing and forget all the other stuff. Maybe instead compare the two healthcare systems. I think that's going to be more acceptable because the idea is you are going to practice where you do residency. If you do residency in the US, you're most likely going to stay in the US, in theory. I love bringing in the support system. I'm really glad you mentioned that you worked in both to show that you have experienced the contrast. Maybe just one more additional thing of what was unique about the two programs or the two different healthcare systems, because there obviously is. And so that's what I'm thinking people will be interested in. But definitely, no matter what, the support system in residency is huge. And having that, you definitely want to say that. You are on your 24-hour night call. It is 1 a.m. You're about to fall asleep and you receive a phone call from an individual who came into the emergency room with suicide ideation. How are you going to handle that situation? So someone comes in with suicide ideation, you just received the page. What are your kind of thought process, how you're going to address this? I left it very open and see where you would go with it because there are so many ways you can do it. And this is one of the most. I get this, at least me being in a Navy base, this is what we get called for multiple times a night for recruits. So this is a typical night for me. It's really good that you said that you were going to keep an open mind, that you were going to check for their safety to see if they felt safe in that area. I think that is huge. I liked that you mentioned just the acknowledgement of fatigue. And it's early in the morning, 1 a.m., and that you've been on call for a while. So I think you hit a lot of valid aspects, but there wasn't anything specifically that I was looking for. I just wanted to hear your thought process. Someone who is agitated. The biggest thing we do is talking and de-escalating them, getting them in an environment that's quiet. That could be a part of the suicide ideation, making sure they're in a safe room, that they don't have anything that they can use to harm themselves, removing any weapons, making sure they don't have access to pens or pencils, making sure they have a sitter, a one-to-one sitter that is always watching them. So anyways, number 1 is verbal de-escalation. 2 is asking them if they would like any medication to help them feel more comfortable, to relax, to be able to think more clearly, to help their anxiety, things like that. If they say no, it depends on if they're being safe to other individuals and to themselves. Sometimes it's easy enough that they say no, and as long as they're not hurting themselves or other, we can just leave them in the room to keep being angry at themselves and turn off the light. If they are actively hurting someone, we tell them we need to make sure everyone's safe here. We have the option of medicine, a pill, or an injection? Which one would you like? So just as long as you're always providing options, would you like a pill? Maybe do you want a pill that dissolves or one that can swallow? Do you want an injection on one butt cheek or on the other butt cheek? Still an option. The last one is restraints. Very last is restraints. Our hospital only does 4-point restraints. The reason for 4-point restraints is because it's the last option. It also depends on, I think they're more easily willing to jump to restraints in the internal medicine floor because everything in that room can be used to harm themselves. So they're less likely to choose something else. And it's not, they forget to call psychiatry. So put on restraints and then call us later to remove restraints. We're like, why are they in restraints to begin with? That is just difference between how internal medicine handles things versus psychiatry. I always like to end by giving you the opportunity to practice asking questions. So first, tell me a couple questions that you plan to ask a program director. Always have 3 questions you're ready to ask, and then if you have additional time, then you have more, but definitely 3 that you've memorized and you're ready to ask. It really, the purpose of the questions is for you to interview them. Always asking people to talk about themselves is key. That's always a great, asking them why they chose to work at this program, why they chose psychiatry. Those are all great ideas because you can get an idea of how they work and think about why am I asking the question and what do I get out of it? Just like how they ask you questions, they're waiting to get some strengths or values or like how you will bring to the program. The questions are now your turn to do that. So if it won't provide you value, then don't ask it. It's like why that program and why psychiatry? Asking for advice would you give me? Especially if they can provide examples that happened to them. That would be really helpful.